Breaking the wall of social isolation. How dementia research improves the lives of patients and caregivers. June Andrews, University of Stirling.
On the 9th of November 1989, I was in London teaching nurses how to use...
So the real question is, what was I doing that day? I'm 60 years old, and I'm planning to be 90 years old one day. So I'm quite interested in this audience. You've had so many talks. Can everybody stand up? Come on, stand up, loosen up yourselves. Now, you're all full of brains, and you know that the thing you mustn't ever do is try to predict anything. But can you sit down if you don't expect ever to be 90 years old? Let's keep standing, all the people who plan to be 90 years old. Okay, that's good. So all of you who are here, look at each other, those of you who are standing, and those of you who are sitting, take a special look at these people. Because when you are 90 years old, you will have a 50% chance of having dementia. Please sit down. Because the first big wall we need to break down in dementia is the wall of awareness. And we really need to be aware of the fact that everybody, I'm not asking you to do this again, I just forgot to move it forward. We really need to be aware of the fact that dementia is going to be an issue for all of us. And I first want to talk about what the walls are for people with dementia. Very many people in this room will have a family member who has dementia, or there might even be people in this room who already know that they've got one of the underlying conditions that causes dementia. But the walls for people with dementia that are often identified, the first one is often the wall of memory. And that's interesting because very many of my friends who have dementia say that the memory problem is not the worst. I have a memory problem at times, and yet I know I don't have dementia. And the reason for that is that the second problem that people with dementia have is a problem with reasoning, with working things out. And so if I can't remember something, I know I ring my secretary, I look at my agenda, and I know what it is I'm doing next. And I can also learn. One of the good ways of illustrating this is what happens when I'm in a hotel. Now, you all look far too respectable, but sometimes some people wake up in a hotel and they're not sure where they are. Has it ever happened to you? It's even worse if you're not sure who you're with, but that's another question. But the key thing about that is that when I wake up this morning in Berlin, I'm not sure where I am, I open the curtains, I can see exactly where I am. I used my reasoning to work out where it was, and of course, actually, this was my second night in Berlin, so I'd already learned the day before. But if you can't do that, life is incredibly stressful. Can you imagine waking up in a room, not sure where you are, and you can't work out where you are? That's a horrible feeling. And that's what happens to a person with dementia because they can't remember where they are, they can't work it out. It's difficult for them to learn. So even if I go in and say, don't worry, it's all right, you're in this room, as soon as I'm gone, the person has forgotten. And that's incredibly stressful. And as we spoke about before with the people of the age of 90, dementia is a condition that mainly affects older people, and so they have the changes of aging. I've learned to wear my glasses in my hair. People keep telling me this is not a fashion accessory, but the point about wearing my glasses in my hair is that I'm never going to be unable to read, because I've met old women in care homes. There was one particular woman who the staff said to me she cannot read, but when we discovered that we were able to get her some glasses and some large print books, of course she could read. She just couldn't cope with the normal changes of aging. Now, those of you who have read my biography will know that I am a nurse, and you can't be with a nurse for very long without discussing embarrassing things, and toilets are usually quite embarrassing. One of the reasons why some families find it difficult to keep the person with dementia at home is because of problems like incontinence. You can imagine the woman saying, oh, well, you know, my mother had to leave because she was having this continence problem, the place was getting smelly, my daughter couldn't bring her friends round, it was all very embarrassing. And what I want to talk about today is the way in which signage can really help people with dementia to find out where the toilet is and can reduce the risk of what goes wrong in dementia. Now, this graphic is something that I've used a lot of times to illustrate what the problems are in dementia. And in order to understand it, you have to really be aware of the fact that if I have dementia at the age of 90 and I start at the top of this journey, I would like to have a journey like this, where I stay well for as long as possible and I go downhill towards the end of my life. So this is the journey I would like, and this is the journey that my friends with dementia say they would like, and those people who think they might be 90 say they want to be like that as well. But actually what happens to very many people is they have another journey, they do the lower journey. And sometimes when I'm talking to the finance directors of health companies, I ask them to vote, would you think that you would prefer the top journey, or do you think you would prefer the bottom journey? Some of the finance directors aren't so smart, and they vote for the bottom journey. They don't realise that the top journey is very expensive. And this is a real economic issue. If you're in a country with a publicly funded health system, your taxes are going to go through the roof. If you're in a country where the family has to pay for care, this is going to make a significant difference to your family wealth and how much money you've got to leave to your children. I want my daughter to spend all my money on champagne and shoes after I've gone. And so I really want to know, and the finance directors cry and they say, we wish we knew what it is that keeps people on the high ground. You know, once I've explained that that's the better ground. So what keeps us on the high ground? There's one thing we absolutely must watch. The research shows us that for a person with dementia, I might be doing all the things that keep me on the high ground. The difficult thing about the research about what keeps you on the high ground is that it's very difficult. We need a new paradigm for research, because some of the things we know that work are things which you couldn't give to one person in isolation and deny someone else, because the thing for which there's the strongest evidence is exercise. So you can't tie old ladies up and see whether they get dementia faster than old ladies that you let to be free range. So it's really important that you think of a new paradigm. But we know some of the things that are these arrows that keep you up there. Now, for example, there is research that shows a glass of red wine a day will keep you on the high ground, and that research is from the University of Bordeaux. The next research that's worth reporting, because I personally don't like red wine, it gives me indigestion. So there is new research from the University of Reading in England, who knew, which shows that glasses of champagne have exactly the same effect. So it's evidence that there is someone up there looking after me. But the interesting thing is that the Bordeaux research was done on humans, and the Reading research was done on rats, but that's good enough for me. So every day in the paper we get reports of how there is a cure for dementia, but there is really no cure. But there are things which will make a difference. One woman in Dublin was saying to me one day that she'd read about coconut oil having some help. Now that really bothered me, because people who are taking too much coconut oil, believing that it works, are actually raising their blood cholesterol to a really dangerously high level, which causes the kind of problems that cause dementia. So I told her about the champagne, and her husband, who she'd been feeding this coconut oil to, looked really grateful. So here I am, walking about in Stirling in Scotland. I've come out the university, out the wine bar after my glass of champagne, and I fall. Old ladies who fall and get fractured neck of femur, fractured hip, have to go to the acute hospital because we can't fix it on your table. And so the hospital turns out to be one of the most dangerous places for a person with dementia. We just said that moving was really important. What happens in hospital? You're told to sit down. What happens if you won't sit down? You're given a sedative to make you sit down. It's really important to realise that a lot of what we do in hospital is problematic. In hospital, people with dementia are more likely to develop delirium. Delirium can be a fatal condition. It's much more likely that you'll get delirium if you've got pain and dementia. But we know that after fractured neck of femur, the people with dementia get given less pain control than other people do. And it's because of the way the pain control is given out. I go to this man and say, do you have some pain? And because he thinks he's at the golf club, he thinks, who is this stupid woman? And he says, go away. And in fact, he's left in his pain. It's not treated. So The good news is that we have some interventions that work. There isn't a cure. We're a long way from having a proper drug, although there are people in here with brains the size of planets who are going to produce that for me. Please make me redundant. I only focus on non-pharmacological interests. But the good news is that design interventions work. Now, of those two women on the previous thing, where one went along the top and one went down, both of them probably had the same level of pathology inside their head. This is a really interesting disease where you can't affect the pathology, but you really can affect the symptoms. That's one of the things that makes it complicated to find a cure, because if I died today, and I have to say, in spite of appearances, I don't have any symptoms of dementia, but I might have symptoms of the conditions, the blood vessel damage or the Alzheimer damage in my brain. So it's really hard to work out if your pills work if you don't know who's got the condition. And that's when we get back to toilets. One of the things that we know about the design of environments for people with dementia is that just increasing the light level can make more difference in some people with dementia than the medication does, the existing medication that we've got. There's a whole raft of evidence for a number of design-related things. This is actually a screen grab from the website at the Dementia Centre at the University of Stirling. And if you run your mouse over the website, then windows will open up to show you what the research evidence is for the things that are there. For example, you can actually see the toilet from where your head is in the bed in this particular room. The commonest reason for getting up in the night is to go to the toilet. If the toilet is hidden, I might wander into the corridor, asking where the toilet is, wetting myself, falling on the slippery floor. So many things can go wrong, and I can end up in hospital with that kind of problem. So we've not only got a dementia-friendly house on our website, but we've also got a dementia-friendly hospital, which we built with the aid of the Robert Bosch Stiftung. And it's a great hospital because when new research comes in, I can change it without even having to bring the builders in. I don't have to talk to the finance director to change what's happening in the room. So I keep going back to the question of the toilet and the problem about research. There are 3 levels of research, or 3 levels of evidence for what makes a difference in dementia. The first level is research that's done involving people with dementia. And an example of that would be the evidence that a person with dementia can walk more swiftly and safely over a smooth, matte, unpatterned surface. This carpet here is perfect for a person with dementia. And when you're building a care home, you only really need to pick the floor covering once. And if you pick one that has patterns because you're trying to make it fancy, the chances of people falling over are very high. And the same is true in hospitals. If you make a shiny surface on the floor, people will fall over. It's very poor. The second level of evidence is extrapolation from sensory and physical impairment. And when I'm old and have slow reactions, I may be slightly late in deciding that I need to go to the toilet. So because I'll have the visual impairments of aging and difficulty working things out, unless the toilet sign is really clear, I'm really not going to see it. I'm not going to be able to understand what's happening. And there is also a problem with noise, has just been beautifully described. The neuroprocessing of sound and noise in people with dementia becomes much worse, and it's hard for them to get instructions or to learn instructions. Actually, I think probably quite soon, because I was holding off until it was time to do the lecture. Quite soon I'm going to have to go to the toilet. And so I'll see if I can finish what I'm saying before I go. So the first thing I said was research that was done on people who, it's really hard to concentrate, research that was done on people with dementia, research that is extrapolation from sensory and physical impairment. And the third area is actually what we would call the third area is really very distracting. You're distracting as well. The third area is what we call international consensus, which basically means what I say is right. Thank you very much.